All right, our next tissue is going to be the connective tissue. This is the second most abundant tissue in the human body, and it is widely distributed. So it's going to be found everywhere. It tends to be found in conjunction with most other tissue types, especially if we're talking epithelial tissue. And its primary role is going to be to support and protect body organs. The cells that are going to be involved here aren't easily classified like the epithelial ones are, where it's simple or stratified, squamous, cuboidal, or columnar. Here we're going to be looking at different types of fibers that are embedded in what we call a extracellular matrix. An extracellular matrix is the material found outside of the cells. And the cells themselves, as well as the fibers, are distributed throughout this extracellular matrix and not in close contact with each other like we would find with the epithelial tissues. All right. So what is its function? We are going to find connective tissues as a support. We talked about a basement membrane when we were talking about epithelial tissues. Connective tissue is that basement membrane. We're going to find them as a binder, holding things together. They're going to be involved in physical protection. I'll point that out when we get there. Immune protection, movement, storage, heat insulation. Yes, connective tissue is part of your thermoregulatory system and transport. So we have some main categories here. We're going to be talking about fibrous connective tissue, which is also known as connective tissue proper. We're going to talk about supporting connective tissue. This is going to be things like cartilage and bone. And we're going to talk about fluid connective tissue, which is also known as blood. Blood is considered a connective tissue. So fibrous connective tissue is the most diverse type. It contains or made up of extremely conspicuous fibers, hence fibrous. This down here is a 3D model of some typical connective tissue fibers. As you can see, they are typically made of multiple strong filament proteins that are twisted around each other. And that multiple strong protein twist is one of a connective tissue's hallmarks. So this fibrous connective tissue is going to be made up of those fibers, going to be made up of cells, and then something called ground substance. So let's talk about this. The cells is where we're going to start when we're talking connective tissue, especially fibrous connective tissue. Some of the main cells we're going to find are fibroblasts. Fibro is also, so here's the thing. Okay, in med term, we mentioned fibro as meaning fiber. An alternative definition is also fat. However, blast is going to remain the same. It is immature or making. So fibroblasts are going to be large flat cells with tapered ends that produce fibers and ground substance. So these are the ones that are creating the compounds found within this matrix. If they're inactive, so they're not actively making ground substance or fibers, they're going to be referred to as fibrocytes. Truthfully, we don't talk about fibrocytes that much because they're inactive. They're not doing anything. They're hanging out. So fibroblasts is the term that you really want to make sure you know. Our macrophages are going to be our second most common cell that we're going to find. And macro for my med term students, you know, means macro, large, phage, eating. So these are large cells that wander around the connective tissue, engulfing and destroying bacteria, foreign particles, and any cells that are dead or dying. They will also activate the immune system when they encounter foreign matter, things that don't belong. They'll convert that foreign matter into what we refer to as an antigen and present that antigen to a white blood cell, triggering the creation of antibodies. We will talk about antigens, antibodies in a later conversation. Now, part of the reason they're able to do this is because macrophages are actually a variation on a white blood cell that we will talk about when we talk about blood, called monocytes. Monocytes are one of the 5 main types of white blood cells, and macrophages are a variation on that. Leukocytes. We're going to find these guys here as well. Leukocytes, white cells, they crawl out of the bloodstream and spend the majority of their time hanging out in the connective tissue. Many of these are going to become another variation on phagocytes that wander in search of pathogens. So these are just looking for things to consume. Plasma cells, another variation on a white blood cell. These are going to be the ones that differentiate, and when foreign agents are detected, these are the ones that can produce those antibodies. Antibodies are proteins that bind to foreign molecules, those antigens, inactivating them and or marking them for destruction. So these guys will light them up going, these don't belong, please come eat them. They're hazard signals. We'll talk more about leukocytes, plasma cells in the appropriate system, which is going to be a combination of blood and the immune or lymphatic system. We're also going to have mast cells found here. These guys typically are found in connective tissue that is adjacent to a blood vessel. And part of the reason for this is mast cells secrete 2 compounds. One is called heparin. And you might be going, wait, heparin, don't I know that from drugs? Yes, heparin is a drug that we give to individuals who, as a anti-clotting agent. Heparin, we produce it naturally though as well because it is an anticoagulant. That's where the drug actually comes from. And then the other chemical that mast cells are going to secrete is something called histamine. Now you might be going, histamine, isn't that thing that I want to reduce when I have allergies? It's what causes all my allergic symptoms. Yes, histamine is responsible for that. But histamine is naturally produced and responsible for a variety of protective mechanisms in the body. Specifically, histamine is going to be a vasodilator, so it's going to expand the blood vessels, increasing blood flow, and this is going to be important for wound healing and infection fighting. Histamine is also going to be involved with the inflammatory response when we are undergoing wound healing. So that's actually going to be something we talk about when we get into the integumentary system portion of this PowerPoint. So the back half. Adipocytes are another connective tissue cell that we're going to be talking about here. Adipo, you guys know, is fat. That one is concrete, never changes. And adipocytes are going to appear in small clusters within some fibroconnective tissues. Here we have an adipocyte right here. If they dominate an area, for instance, the subcutaneous layer of the integumentary system, so something we'll talk about here in 4 audios, then it's referred to as adipose tissue. And basically what adipocytes are is they contain a huge droplet or droplets of lipids for storage purposes. They don't really do anything else. Here we have our fibers. We're going to be talking about collagenous, reticular, and elastic fibers. Collagenous fibers, interwoven strands of the protein collagen, which is the most abundant protein in the human body. These are very thick fibers with a great tensile strength, which translates to, if I'm trying to pull them apart, they're extraordinarily difficult to pull apart. In fresh tissue, they have a white appearance, so they are sometimes called white fibers. However, when we put them on a microscope slide and stain them, they turn pink and usually appear very wavy. What sort of place, apparently having issues talking. Where do we tend to find these? Everywhere. Why everywhere? Collagenous fibers are in the deep layer of the skin, the dermal layer. You have skin everywhere. Skin is the largest, heaviest organ in the body. Therefore, you're going to find this guy in many, many places. However, it also is what creates tendons and ligaments. What are tendons? Tendons are connective tissue strips that connect your muscles to bones. Ligaments are connective tissue strips that connect your bones to bones. Why is this important? Well, think of all the bones in your body, what you are aware of right now. Think of all the muscles in your body, what you're aware of right now. There's a lot. So we'll talk about tendons, we'll talk about ligaments in units 5 and 6. However, I do want to stress that you really need to make sure you have which connects what straight in your head, because students tend to confuse tendons and ligaments. So tendons are going to connect your muscles to your bones, ligaments are going to connect your bones to your bones. You really want to make sure you have those straight in your mind. Reticular fibers, these are also collagen fibers, but they're much thinner, and they're also coated in a glycoprotein coat. What is a glycoprotein coat? It is a carbohydrate amino acid compound that this collagen fiber is coated in. When we stain them, they appear black. So all these black strands in this liver slide, those are reticular fibers. What's the purpose of a reticular fiber? Reticular fibers are going to branch and form networks and frameworks for within certain organs to support cells as well as to support organs in conjunction with each other. Elastic fibers, these are going to be composed of a protein called elastin. They are going to have a coiled structure, and this coiled structure is going to allow them to stretch and rebound, very similar to a rubber band, hence elastic. This is what's going to account for the ability of your lungs, your arteries, and your skin to spring back after it's stretched. Pinch your skin anywhere, say you're on your forearm, pinch it up gently, and then let go. It bounces back into place. Now, I will say this, if it slowly bounces back into place, you are probably dehydrated, at least a little bit. So that's your sign to go drink more water. Fresh elastic fibers are going to appear yellow, so we also refer to them as yellow fibers. All right, now all of these fibers and cells are going to be embedded in a substance known as ground substance. What is ground substance? Ground substance is a gelatinous material that occupies the space between these cells and fibers in connective tissue. Think of it like Jell-O. As the example over here think of it as a Jell-O mold. Think of the 70s, 80s, when people made these Jell-O monstrosities with all this stuff embedded in it, whether or not it was actually good. And the Jell-O is that ground substance. Everything that's in it. So let's say it's a semi-decent Jell-O mold. So it's got like grapes and apples and maybe pineapple. Those are going to be fibers, various fibers and various cells. That's ground substance. It's just a gelatinous, jello-like material. All right, now, fibrous connective tissue is divided into two different types based on the abundance of those fibers. Loose connective tissue has a lot of ground substance and cells, not a lot of fiber, lots of empty space. Dense connective tissue is exactly what it sounds like. It is dense. It's closely packed. There's a much lower number of cells and ground substance, and there's a high number of fibers. Loose connective tissue, there are three main types: areolar, reticular, and adipose. Areolar is a loose arrangement of collagenous and elastic. A little bit of reticular though. So it does have all three, just more of the first two, or of the other two. Scattered cells, all six are going to be present though. Abundant ground substance, and numerous blood vessels. So this is highly vascular. Where do we find this? Underlying all epithelial, nearly all. So it's an underlying tissue. We also find it surrounding your blood vessels. We find it surrounding your nerves, your trachea, your esophagus. We find this between muscles. If you have ever butchered a chicken or a deer, rabbit, ever separated out, butchered your own meat, there's that when you pull apart muscles for, say, like a brisket, there's this almost like cobwebby type membrane that appears as you're pulling it away. That's this tissue. You also find it within the mesenteries and visceral layers of those pericardial and pleural tissue sacs. All right, so if that's where we find it, what is it doing when it's there? That's going to loosely bind the epithelial to deeper tissues. It's going to allow for the passage of nerves and blood vessels through to other tissues. It's full of white blood cells, which means it's going to provide an arena for immune defense. Think of where we find it. Surrounding blood vessels, nerves, trachea, and esophagus, places where we have a lot of potential to come into contact with foreign materials. So it's going to be an immune defense arena, and it's going to help blood vessels provide nutrients and waste to those underlying or overlying epithelium. Because remember, epithelial tissues tend not to be vascular. So they have to get their nutrients and their oxygen up to them through diffusion. Reticular tissue, under a microscope, this is going to be a loose network of those reticular fibers, so it's going to have a lot of black strands, ropes through it. It's going to be have a type of fibroblast that we refer to as a reticular cell. It's going to have numerous white blood cells that we talked about, and typically appear that dark purple black because of the reticular fibers and fibroblasts. So where do we find these? Lymph nodes, spleen, thymus, bone marrow, places where we need a lot of structure and framework, but we also need a lot of wound healing and defense, because its role is wound healing. This branching framework of reticular fibers will form a scaffold-like framework within lymphoid organs, such as the spleen, thymus, and lymph nodes, to support the various functions. That framework is going to be referred to as a stroma, and the functional tissue is actually referred to as the parenchyma. Adipose tissue. This is going to be close packed cells dominated by adipocytes, large empty-looking cells with thin margins. I mean, if you're looking at this, you would be forgiven for thinking that this is like not living. But these are all adipocytes. The nucleus is usually pressed against the cell membrane, giving a signet ring type appearance, and that's because the vast majority of this cell is going to be that pouch of adipose, or lipids, I should say. So unlike in our traditional cell, that nucleus will be pushed to the side. Because it is predominantly lipid, it will be very, very pale, and because this is storage of energy, potential energy, has to be broken down into compounds in order to actually use, but it is potential energy. it is typically going to be highly vascular. So where do we find adipose tissue? Subcutaneous fat layer beneath your skin, breasts and buttocks. Heart surface. Yes, the surface of the heart has adipose. And pretty much anywhere you have organs, specifically kidneys and eyes, but adipose tissue is used as a cushion. Not only does it store energy for later, it acts as a cushion. So when I'm jumping up and down, if I've got a dog slamming into me, a cat deciding I make a great landing surface in the middle of the night, like a kid on my hip, that adipocyte is cushioning my internal organs so they're less likely to take damage and they're not likely to knock into each other, causing damage. So as I mentioned, energy storage, thermal insulation, like I mentioned, we will get back to that when we talk about the integumentary system, shock absorption, and protective cushioning. All right, dense connective tissue is divided into two categories, dense regular and dense irregular. Dense regular is exactly what it sounds like, densely packed, parallel, often wavy collagen fibers, not a lot of open space, so very little ground substance, not a lot of blood vessels, and we're going to have slender fibroblast nuclei compressed between bundles of collagen fibers. So this is going to be in places like your tendons and ligaments. This is an artistic rendering. This is the actual microscope. As I mentioned, ligaments bind bone to bone, and when this dense connective tissue is in a ligament format, it is helping to resist stress, helping to resist those bones from pulling apart. If it is found in the tendons, which connect your muscles to bone, they're going to enable the transfer of tension from the muscle to the bone. Why is that important? That transfer of tension from the muscle to the bone is what's going to enable the muscle to pull on the bone, moving whatever you're doing. So if you're doing a bicep curl, if you're walking upstairs, walking across campus, sitting, standing, whatever the case may be. Dense irregular. This is going to be densely packed collagen fibers running in random directions, not very organized when compared to dense regular. Still not going to be a lot of open space, so very little ground substance, not a lot of visible cells, and not a lot of blood vessels. So where do we find this? Deeper portion of the dermis of the skin, so we'll get into that later in this PowerPoint. It's also going to be the capsules that surround your visceral or abdominal organs, so the layer that surrounds and contains your liver, your spleen, your kidneys, that's going to be made up of this tissue. It's also going to be the fibrous sheath around your cartilage and bones. So we'll talk about the fibrous sheath in Unit 5. Why is it used there? This irregularity actually provides a very durable, hard-to-tear structure that is able to withstand the stresses placed upon it when it is pulled in unpredictable directions. Okay, this is important. Tendons, ligaments, they're going to have predictable points of stress. So they are going to be able to run along patterns based on the muscle, the bone, the bones that they're connecting. And so they can align themselves for the predictable stress points. If I'm the underlying surface of my skin, if I'm covering my spleen, my kidneys, I can't necessarily pinpoint what direction the stress or wear and tear is going to come from. That's where this tissue will become into, is excellent. Because these collagen fibers go every which way, they're able to respond in any direction. Supporting connective tissue, these are going to provide the majority of the structural support of the human body. So they come in two types, cartilage and bone. Cartilage and bone are both considered connective tissues along with your blood and fat. So cartilage. Cartilage is a supportive connective tissue that has a flexible rubbery matrix. These cells involved with cartilage are called chondroblasts. Chondroblasts are going to be the cartilage cells that secrete the matrix and surround themselves in it until they become trapped. The little cavities they create are of substance are called lacunae. It's Latin for lake. Once they are enclosed in their individual lacunae, they are now called chondrocytes. So chondroblasts are actively secreting collagen, chondrocytes are maintaining it. All right, cartilage. Cartilage is avascular, and the chondrocytes are going to depend on the diffusion of nutrients through that stiff, viscous matrix. Their metabolism and rate of division, aka mitosis, is going to be low, and this is actually why the healing of torn cartilage is a long, slow process. So you tear your rotator cuff, you have a torn meniscus in your knee. It takes forever to heal. This is why there's not a lot of blood flow to that region. Now, why is it avascular? Chondrocytes secrete a chemical called anti-angiogenesis factor, which actively inhibits the growth of blood vessels. So it's actively preventing them from arriving. In this matrix, we are going to have collagen fibers that are going to range in thickness from basically invisible to I can see them very clearly. Cartilage is divided into three classifications: hyaline, elastic, and fibrin. Hyaline cartilage is a clear, glassy matrix. When we stain it on a microscope slide, it typically takes on a light blue to pink appearance. Hylos is Greek for glass. It has a glass-like appearance here. Collagen fibers tend to be very fine, well dispersed, not typically visible. The chondrocytes themselves are typically going to be in clusters of 3 to 4 within a single lacuna. These are basically cell nests. So instead of having one cell per lacuna, it's 3 to 4 per lacuna, little clusters. This is all going to be covered by a perichondrium, which is a fibrous sheath made up of that dense, irregular connective tissue. And where do we find this? Hyaline cartilage is going to form the majority of the fetal skeleton. So when you are born, the vast majority of you is hyaline cartilage, which is why you're actually able to slip through the birth canal. If you are all bone, you wouldn't fit. You could not squish together enough to fit through. It's also later in life going to stick around by forming the box-like structure around your larynx and the supportive rings of your trachea and bronchi. It's going to be the attachment cartilage for your ribs to your sternum, and it is going to form the thin articular cartilage that covers the ends of bones at movable joints. So we will be talking about articular cartilage when we talk about joints, which is in our bone unit, and which is unit 5. And so we will be talking about that more there. So its functions: ease joint movement, keep airways patent or open, move your vocal cords. It's the precursor of bone, and provide structural attachment. Elastic cartilage, under a microscope, it's going to have a web-like mesh amid its lacunae, also going to be covered with perichondrium. Where do we find it? External ear. Fold your ear up, pinched around. If it pops back into place, That's elastic cartilage. We're going to find it at the epiglottis. The epiglottis is a flap that covers your trachea when you swallow. This is to prevent food and fluid, usually water, from going down the wrong pipe. So whenever you say, oh, it went down the wrong pipe, it literally went down the wrong pipe. Water does not belong in your lungs. Your lungs don't like it. They really, really hate it. We will talk more about that with the respiratory system. Then we're also going to see this tissue with the eustachian tube. The eustachian tube connects your ear to your throat, specifically the nasopharynx portion of the throat, and is what enables your ear to drain. However, it is also what enables things like ear infections to occur after you have had strep throat. So, what does it do? Provides flexible elastic support. Has to be able to rebound, recoil. Last connective tissue. Fibrocartilage. Fibrocartilage is going to have a parallel collagen setup similar to our tendons. It's going to have rows of chondrocytes and lacunae between those collagen fibers. However, they're going to be fewer, smaller, and they're not going to be in groups. This is never going to have perichondrium, so it will not have that outer connective casing. Where do we find fibrocartilage? Fibrocartilage is found at various joint spaces. The pubic symphysis, so the place where your two pubic bones meet at the front of your pelvis. It is the intervertebral discs, so the gelatinous pad that separates your vertebral bones in your spinal column. If you've ever had a disc herniation or heard people talking about disc herniations, it is this fibrocartilage that is bulging and jellying out of where it's supposed to be between the bones. It is also going to be what makes up the menisci, or the shock absorbing pads in the knee joint, and we're also going to find it wherever tendons insert into bones near articular hyaline cartilage. Based on where we find it, what does it do? Fibrocartilage is designed to resist compression and absorb shock. Think about your spine. We don't want those vertebral bones knocking into each other. When they do that, we're going to compress the spinal cord. If we compress the spinal cord, signals can't get through. So it helps keep those spaces open so the spinal cord can move freely. It also is going to be a transitional structure between dense connective tissue and hyaline, so that tendon-bone junction. Moving to bone, osseous tissue. This is hard calcified matrix with collagen fibers. Our cell here is going to be an osteocyte. These are also going to be found in lacunae. However, unlike chondrocytes, they are well vascularized. Bones are going to provide support, protection, and levers for muscular action. This is something we will get into in Unit 6 when we talk about muscles and how they move things. But if I contract my bicep muscle, it is going to pull on my ulna. Ulna. And when it pulls, the ulnar is a lever. That pull is going to move my forearm closer to my upper arm. That's what it's talking about. Bone is also going to be a storage site for calcium, minerals, and fat. Yes, fat is stored in your bones. Where is it stored? Well, it's stored there in one of two types of bone marrow. Bone marrow is the inner portion of your bones, specifically your long bones, but all bones. The inner area is referred to as marrow. If it is red marrow, it is going to be the site for hematopoiesis. What is hematopoiesis? My med term students, take a moment, pause this, break it down. Hemato, hopefully you remember, is going to refer to blood. Poiesis is formation of. So hematopoiesis is the formation of blood. Speaking of, blood is going to be a combination of red and white cells in a fluid matrix that we refer to as plasma. It's contained within blood vessels and functions as the transport of respiratory vessels, nutrients, and wastes. And we will talk about blood in far more detail with the cardiovascular system.